Welcome to the We Care podcast. I'm Jordan Vaughn, nurse practitioner.
And I'm Molly Cooey, RN at We Care. Welcome back. We're so excited for you to be here. Who's ready to take a deep dive into hormones? I know I
am.
Me too, girl.
We're going to talk about some hormones, longevity, hormone balance, replacement, and just how they play a overall huge role in our energy, mood, weight, sleep, basically everything that makes us feel who we are and what we do on a daily basis.
If you've ever said, I just don't feel like myself, today's episode is for you. Jordan, what exactly do hormones do?
So, hormones are small little chemicals, and they're basically little messengers. They tell our body how to function, different organs how to function, from metabolism, stress response, sleep, sexual health, emotional regulation. That's probably the biggest one. They control so much behind the scenes. When your hormones are off, you don't just feel tired. You can feel brain fog. You can feel irritable, bloated, unmotivated. There's so many different symptoms that come along with hormones.
Right. And that's typically when clients come to us saying like they've been exercising, they eat right, they're doing all the right things, but they just feel blah. That's when you step in and start looking a little deeper. So can you kind of walk me through an initial visit for looking at hormone replacement?
Absolutely. So the first thing, we have patients call in and they usually just say, I want a consultation. Instead of doing the consultation first, we decided to bring them in to do a lab visit first. So when they came in to see me before getting labs, it was hard to really deep dive and figure out exactly what was going on. So we decided to start doing labs first. So come in, you'll see the MA. She'll draw a full panel of labs. Once we get those back, I'm going to do a deep dive in the labs and figure out what's going on. What can I help this patient with? And then we will go over the labs with the patient, just making sure, that they understand what I've seen, and then give them the option. Do they want to come in for a deeper dive into the labs with me, with a consultation, or are they ready to, dive right in and let's, schedule them for a hormone visit? That may be pellets, that may be injectables. It may be the thyroid hormones that we're addressing in that visit. There's so many different things, but we would, pick the route of what we're doing. And then if it's pellets or injectables or thyroid hormone that we're addressing, we will, get that going at that visit and bring them back in 5 weeks and just see how they're doing, draw their labs again, make sure that we've rebalanced, those hormones.
Right. It's always refreshing when the patients come back and let us know that they finally feel like themselves again.
Yes.
That just plays into the magic of hormone balance.
Right.
Jordan, I know that there are a lot of women especially that are concerned over hormone replacement because they hear the word cancer and are concerned that hormones or hormone replacement therapy causes cancer. How would you address that myth?
Okay, so no, hormones do not cause cancer. If hormones caused cancer, then all of these teenagers that have raging hormones would be walking around with cancer. Or if hormones cause cancer, then our pregnant ladies who have 100 times the estrogen of their normal system when they're not pregnant, they would be walking around with cancer too. Now, someone who already has a estrogen positive, say breast cancer, or a estrogen, positive receptor, then they are more at risk to develop further cancer or more aggressive cancer from the estrogen replacement. So it doesn't cause it, but it can add to it if they already have that receptor.
Perfect. Thank you for clearing that up.
Yes, absolutely.
That is definitely one of the most asked questions. I know
Yes.
we've seen that all over social media lately too.
Yes.
Can we talk a little bit more about bioidentical hormones? I know people also hear that phrase a lot as well.
Yes. So bioidentical is molecularly similar to our natural hormones. So our body naturally makes hormones, and then this is coming from flowers or different things, and it's made up to fit like a key just into our normal hormone receptors. So it's not what you would say lab made, that kind of thing, or I'm trying to think the right way to say that exactly. It's not chemical, you know what I mean? It's not chemically made up. It's actually meeting the exact same receptor as our natural hormones do. They support, when you do bioidentical hormones, they support longevity, they support your bone density, cognitive health, muscle preservation, and they actually help with cardiovascular health too, and can lower the cholesterol. So there's so many good positive things from bioidentical hormone therapy, and research now shows that optimizing those safely, obviously, can truly support long-term health and cardiovascular risk, diabetes risk, and also just giving those symptoms relief.
Right. We love symptom relief.
Yes.
And of course, longevity is key for everyone too. Not necessarily everyone wants to live forever, but I do think most of us want to live a nice long life, and it's not necessarily worth living for a long time if you're not able to enjoy your life as well. So that hormone support can help in that as well. Me personally, I can't even begin to tell you how many clients I have come in to see me, and they lay back in my chair for cosmetic injections, and they just start talking about how they just don't feel right. Or they're moody, or just tired all the time. And I ask if they've ever had labs checked, their hormone levels checked. And a lot of them are, well, my primary care has done labs, or I had labs with my OBGYN, and they just told me everything was fine. And they're like, but I just do not feel right. And that's when I'm like, okay, we need to do some more research here. Let's look into it a little more. Let's draw some more labs, and let's let Jordan take a look at this. Because I know most of those clients that come in and start on hormone replacement therapy with you, 99% of them are in your chair every 3 months. They are not missing that appointment.
No, ma'am. My hormone replacement therapy patients, they are like clockwork. They do not miss their appointments. And if they do, they are trying to beat down the door to get it rescheduled if it was an emergency.
Yes.
Men and women.
Yes, I know. I've fielded many phone calls for that, trying to find a cancellation spot for that.
Yes.
So tell me a little bit about what a hormone replacement, what a pellet appointment looks like.
So when patients come in for or choose the hormone pellet route, we would bring them in, and it's a small procedure, and that's kind of why I like to talk about it. It's not scary. People are so scared about it. They watch the YouTube videos about it, and they come in and they're freaking out, but it's really not that scary. So we bring them in. Obviously, we do a history intake, we do their vital signs, and then we numb the area. So it doesn't hurt. It's nothing major. It's a little quick shot of lidocaine. It's no different than if you were to get a B12 shot. So it does not hurt. Once that area is numb, it's a tiny little incision, and it's literally smaller than my pinky nail, and we insert the pellets there, and it's closed with 2 little steri strips. So we don't have to suture it. We don't have to do anything like that. Very, very tiny. And then it takes about 3 to 5 days. Those steri strips will fall off, and I would say within 2 to 3 weeks, the patients are starting to feel a little better. They're starting to kick in, and by that 5-week mark, we're bringing them back in. We're checking in with them. We're seeing how, the hormones worked for them. And I'm telling you, by that time, they're raving. They are literally, they don't even need the labs. They know that was what was wrong. They're like, I feel better again. Me and my wife aren't fighting anymore. I'm nicer to my kids now. Our sex life is back. I'm able to get up in the mornings without hitting snooze 50 times. There's so many good reactions when people come back for those labs. I'm telling you, if we could just skip the labs, that would be fine. But that's not what we do medically, And then I would say maybe 1% of the time, they're still a little bit, off. And if that is the case, if they're still a little bit off, we bring them in for a free booster dose. So we do not charge them, but it's like any other medication. You may have to readjust the dose sometimes. So I just bring them back in. We do the procedure over again, add just a little bit more, and then they're good to go for their 3 to 4 months for females or 5 to 6 months for males.
That's awesome.
Yes. And then I did want to talk a little bit too, because some people, they're maybe scared of pellets or having something inserted inside of them that's going to be there long term, kind of scares them. So we do have other options for our patients. That may be shots. Some females, they like patches over actual pellets for their estrogen. And then as far as creams, that is an option. I haven't seen it it's not as effective, so most patients don't choose that route, but it is an option if we absolutely had to.
It's awesome to have all of those, you know, kind of tools in the toolbox.
Yes, so many tools.
So key thing here too is, remember that you don't have to wait until you're miserable. Mm-hmm. Prevention can be key here too. Yep. So that's going to be a wrap today on hormones and longevity. We hope this empowers you to take control of your own health.
So be sure to tune in next time. We are going to do a deep dive in all things neurotoxin, which is Botox.
So make sure to subscribe, follow us, and share this episode. And just remember, at the end of the day,
we care. Have a great day.